Look closely at Selena Gomez's face in her latest photos, and you might notice something different about her nose. Or at least, that's what thousands of fans are claiming as rhinoplasty rumors sweep across social media like wildfire. The 33-year-old newlywed has found herself at the center of intense speculation about whether she went under the knife, with plastic surgeons now jumping into the debate to share their professional opinions on what they see in her transformation. If you love celebrity transformations and expert analysis, make sure to subscribe, because we're diving deep into what the doctors are really saying about Selena's appearance. The conversation started innocently enough when eagle-eyed fans began comparing photos of Selena from different points in her career, noticing what they believed were subtle changes to the shape and structure of her nose. Social media platforms exploded with side-by-side comparisons, zoomed-in screenshots, and heated debates about whether the singer and actress had opted for cosmetic enhancement. The speculation grew so intense that medical professionals decided to weigh in, offering their expert assessments based on publicly available images of the star throughout her time in the spotlight. Dr. Ryan Merckx from the Merckx Institute in Miami took a close look at the evidence and shared his professional opinion with the Daily Mail. According to his analysis, Selena appears to have undergone what he describes as a well-executed rhinoplasty. He pointed out that in earlier photographs, her nasal architecture featured more widely splayed nasal bones and a softly broad mid-vault, characteristics that gave her face a naturally open and balanced quality. These features were part of her signature look during her younger years in the entertainment industry. However, Dr. Merckx explained that more recent images tell a different story. The nasal bones now appear refined and drawn closer together, which has created a narrowing effect in the mid-vault, essentially the middle third of the nose. This change has resulted in a more streamlined overall profile that catches light differently than before. The doctor noted that her light reflex points, which are essentially the highlights that reflect off the nasal tip, are now more centralized and cohesive. This particular detail reflects what he believes is precise sculptural refinement, a hallmark of skilled cosmetic surgery. The Miami-based surgeon went even further in his analysis, pointing out a subtle detail that most casual observers would miss. In certain lighting conditions, he observed what appears to be a faint linear shadow along her mid-vault. This type of shadow is actually a recognized side effect that sometimes occurs following rhinoplasty procedures. Dr. Merckx explained that this shadow likely indicates a separation in the cartilage bone junction, which can disrupt the smooth transition of light along the bridge of the nose. While this is a subtle feature, it's something that experienced surgeons recognize as a postoperative characteristic. The doctor added that this particular issue can be addressed through a minor revision procedure, or even with precise filler restoration to reestablish surface continuity. Despite his detailed observations, Dr. Merckx was careful to acknowledge the limitations of his analysis. He emphasized that celebrity imagery today is heavily filtered, edited, and manipulated for perfection, making it nearly impossible to reach definitive conclusions based solely on photographs. Nevertheless, he stated that the convergence of several anatomical changes, including the narrowed mid-vault, refined tip, altered columella, and the presence of that mid-vault shadow, strongly indicate in his professional opinion that she has indeed undergone rhinoplasty. But not all medical experts agree with this assessment. Dr. John Diaz, a Beverly Hills-based plastic surgeon, offered a completely different perspective when he examined the same photographic evidence. He told the Daily Mail that he doesn't see any concrete evidence that the actress has undergone a rhinoplasty procedure. Instead, he attributed the apparent changes to natural aging and maturation of facial features. According to Dr. Diaz, her nose does seem a little more defined than it did when she was younger. But this is actually a common occurrence as people age, and their faces naturally mature over time. Dr. Diaz pointed to specific anatomical features that support his conclusion. He noted that Selena has a noticeable edge to the cartilage at the bottom of her tip on either side, and this feature appears unchanged from older photos. In his professional opinion, this consistency makes it less likely that she had rhinoplasty surgery, as such procedures typically alter these specific structural elements. The surgeon also brought up another factor that many people overlook when analyzing celebrity appearances: weight loss. He explained that weight loss can reduce what he called the pudginess of the nose, creating a more defined appearance without any surgical intervention. The Beverly Hills surgeon also noticed something else that could explain the perceived changes in Selena's nose. He observed what appeared to be makeup on her nose in some photographs. Contouring techniques have become incredibly sophisticated in recent years, and skilled makeup artists can create the illusion of a more defined nose structure using nothing but shadows and highlights. Dr. Diaz suggested that Selena is likely employing some of these contouring techniques, which would explain why her nose appears more refined in certain images. He also reminded fans that many photos shared online are touched up and edited before they reach social media platforms, and this digital manipulation could be a final contributing factor making her nose appear more refined than it actually is in person. The Daily Mail reached out to Selena's representatives for comment on the speculation, but as of now, there has been no official response to the rhinoplasty rumors. This isn't the first time the star has faced intense scrutiny over her physical appearance, and she has been remarkably open about how difficult it is to navigate constant public commentary about her body. Recently, she admitted that receiving negative remarks about her weight was genuinely painful and affected her emotionally. She described being stung by a person saying she was fat, and questioned why that particular emotion kept surfacing in her life. The actress has been candid about dealing with weight issues throughout her life, acknowledging that this is something she's very sensitive about due to her personal history. She reflected on understanding that some of her emotional reactions stem from a time when she was going through medical stuff and had gained weight as a result. During that period, the public commentary was particularly harsh, and she found herself at the center of body-shaming attacks. Selena emphasized that doing the inner work to overcome these sensitivities can be tricky, but it's necessary for emotional health and well-being. In her documentary from a couple of years ago, Selena revealed the true emotional toll of cruel comments about her fluctuating weight. She explained that her weight would constantly fluctuate because she would be on certain medications for her health conditions, but people just ran with negative narratives anyway. It felt like critics couldn't wait to find something to bring her down, and she was being shamed for gaining weight because of her lupus diagnosis. The autoimmune disease has significantly impacted her life, including causing visible physical changes that became fodder for online harassment. The singer admitted that she lied to the public about how much the comments affected her. She would go online and post a picture of herself with captions saying, "It doesn't matter," and that she wasn't accepting what people were saying. But the reality was completely different from the brave face she showed the world. All the while, she would be in the room posting those defiant messages and crying her eyes out because nobody deserves to hear those hurtful things. The disconnect between her public persona and private pain was enormous, and maintaining that facade took a significant emotional toll. Selena explained that even though she was posting things claiming the negativity didn't bother her, her real motivation was protecting other people who were experiencing the same thing. She didn't want others who were getting shamed for what they look like, who they are, or who they love to feel alone in their struggles. She thinks it's profoundly unfair that anyone should be made to feel less than simply because of their physical appearance or personal circumstances. Her advocacy for body positivity comes from a place of genuine pain and understanding of what it feels like to be on the receiving end of relentless criticism. Back in 2023, Selena directly addressed cosmetic surgery speculation by stating that the only cosmetic procedure she's ever had is Botox. This clarification came in response to a physician's video online which speculated about various cosmetic surgeries she might have had done over the years. She responded directly to the video with visible frustration, explaining that she was on steroids because of a lupus flare-up and had received Botox injections. But that was it. She explicitly asked people to leave her alone, clearly exhausted by the constant scrutiny and unfounded speculation about her medical and cosmetic choices. The debate about whether Selena has had rhinoplasty continues to rage on social media, with fans and critics analyzing every angle of her face in recent photographs. Some people remain convinced that the changes they observe can only be explained by surgical intervention, while others agree with Dr. Diaz's assessment that natural aging, weight loss, makeup techniques, and photo editing are responsible for any perceived differences. The conflicting expert opinions only add fuel to the fire, giving both sides of the argument ammunition to support their positions. What this situation really highlights is the intense pressure celebrities face regarding their physical appearance and the impossible standards they're held to by the public. Selena is scrutinized whether she gains weight, loses weight, looks different, or stays the same. The constant commentary from strangers about her body has clearly taken an emotional toll, as evidenced by her candid admissions about crying while pretending to be unbothered by hurtful comments. The fact that medical professionals are now analyzing her face and debating surgical procedures without her consent adds another layer to this invasion of privacy. The rhinoplasty speculation also raises questions about our cultural obsession with celebrity appearances and the need to explain every perceived change through cosmetic procedures. In an era of filters, editing apps, professional makeup, and sophisticated lighting techniques, photographs can show dramatically different versions of the same person without any surgical intervention. Yet the immediate assumption when someone looks slightly different is that they must have gone under the knife, rather than considering the multitude of non-surgical explanations that could account for variations in appearance. As the debate continues, Selena remains focused on her career and her recent marriage to Benny Blanco. She's built an impressive body of work spanning music, television, and film, and has used her platform to advocate for mental health awareness and body positivity. Whether or not she's had a rhinoplasty ultimately shouldn't matter to anyone except herself. But the public's fascination with celebrity transformations means these conversations will likely continue regardless of what the truth actually is. If you found this analysis fascinating and want more celebrity news and expert opinions on the latest transformations, make sure to subscribe to stay updated on all the breaking stories and insider information that everyone is talking about.